Aphorism 194. It is not useful either in acute local diseases or of recent origin or in local affections that have already existed a long time to rub in all apply externally to the spot an external remedy even though it be the specific and when used internally salutary by reason of its homeopathicity, even although it should be at the same time administered internally for the acute topical affections, for example, inflammations of individual parts, erysipelas, etc., which have not been caused by external injury of proportionate violence but by dynamic or internal causes yield most surely the two internal remedies homeopathically adapted to the perceptible state of the health present in the exterior and interior selected from the general store of proved medicines and general without any other aid. But if these diseases do not yield to them completely, and if there still remain in the affected spot and in the whole state, notwithstanding good regimen, a relic of disease which the vital force is not competent to restore to the normal state, then the acute disease was, as not infrequently happens, a product of sora which had hitherto remained latent in the interior but has now burst forth and is on the point of developing into a palpable chronic disease. Explanation. In this aphorism, Dr. Henneman has given idea about necessity of ointment. It is not useful to rub in or apply an external remedy even though it is specific, either in acute local diseases of recent origin or in chronic local affections. But when medicine is used internally because of its homeopathicity, even though it is administered at the same time internally, it cures the local affection. Acute topical affections, for example, inflammation of the individual parts, erysipelas, which are not caused by external injury but by internal dynamic causes. Such topical affections yield to the internal remedies which is chosen homeopathically after considering the perceptible state of health present in the exterior and interior of the patient, and medicine is selected from the collection of the proved medicine. Local diseases yield to such internal medicine without any other aid. But when such local diseases do not respond completely to such a homeopathic internal medicine, if still local spot or affection remain and disease still remains in the interior, in the whole state, in spite of good regimen, and the vital force is not competent to restore the disease to normal state, then the acute disease by the effects of sora burst out. Sora generally remains latent, inactive in the interior of the organism, and it bursts out in the form of acute disease and is on the point of developing into a palpable chronic disease.